As we continue the forum this week, we are pleased to have physicians and professionals from LECOM Health as part of our lecture platform. A college of osteopathic medicine in Erie, Pennsylvania, LECOM Health is comprised of the nation's largest medical college, Mill Creek Community Hospital, and the physicians' practices of Medical Associates of Erie. This is a highly innovative healthcare and education system that strives to add to the quality of life of our neighbors by bringing total healthcare to the community. My name is Vanessa Weiner. I serve Chautauqua Institution as marketing manager, and we're very happy to have two lecturers with us today. I'm going to introduce the first one, and he's going to introduce his colleague as well. Dr. James Lynn is a graduate of the Lake Erie College of Osteopathic Medicine and Vice President of the Senior Services and Adult Living for LECOM Health Mill Creek Community Hospital. He is a clinical professor of geriatric medicine at LECOM. Dr. Lynn was involved in the planning, design, and opening of the LECOM Senior Living Center in Erie, a 138-bed skilled nursing home in Erie, Pennsylvania. Today's topic is creating a livable community for the 50 and over generation. I'm just going to ask that you hold your questions until the end of the presentations. We'll be going around with a mic at that point to take Q&A. And I welcome Dr. James Lynn, so please give him a warm round of applause.
Thank you, Vanessa. It's always a pleasure to be back. This is the third year that I had the privilege of coming back to lecture. But this year is a little bit different because I think all of you are in for a treat because this year I have my colleague, Dr. Melanie Titzel. Her expertise is exactly in how to build a senior living community and how to be successful. Can you hear me? Yes. Okay. Can I take this or? Okay, can everybody hear me now? Okay, sorry about that. Is this better? Okay, I can also speak louder and scream. So, as I was saying, we have a privilege of having Dr. Titzel joining our team last year to LECOM Health. Her expertise is in senior living. And she did her dissertation. She graduated from Mercyhurst University, received her Ph.D. And her research and her expertise is in care burden, resource moderation, and how to utilize community resources to help reduce care burden, stress, as well as how to take care of our aging community. So I think this is a very important topic because all of us know by the year 2030, there's going to be over 75 million Americans over the age of 65. And the 85 and above is the fastest growing age segment in our populations. By the year 2030, there's going to be over 10 million individuals over the age of 85. So that's our traditional old. So as we age, we talk about how do we build a successful community, and as we age in the spectrum of aging depending on our function, I think all of us would agree that the definition of community changes a little bit depending on how function you have and what at the time of your age, what activities you enjoy doing. And the question, hopefully at the end of this 30 minutes, Dr. Titzel and I can help you, number one, learn about what successful aging is about, learn about what a normal aging process is all about, and how does the normal aging process interact with our environment. And therefore, the bigger picture is when that happens, how do we stay in the community and build the community to optimize your function and therefore improve the quality of your life. When, towards the end of your life, you've worked all your life, this is the time really to enjoy life. And how do we do that? And in the process of talking about this, you can't get away from talking about, as you age and you have chronic diseases, one, how do we do prevention? Two, how do we maintain your function? And three, if you do in fact get sick, how do we navigate our health system so that we can get you back to your highest functioning capacity and therefore build a community? So again, the definition of community may change as you age, and I'm not going to talk anymore. I'll let Dr. Melanie talk, but hopefully She'll go through this, and then we'll be around for the last 10 minutes to answer any questions. Okay? So without further ado, Dr. Melanie Titzel.
Thank you very much. Can everyone hear me? Okay. So the idea of building a successful community, we at LECOM feel that we have created a good model, and I know you're from all over the country, so I will hopefully be able to impart some ideas or some inspiration when you go back to your hometown, that you can seek out these things or help develop these things in your own town. To have a model community, the idea of successful aging cannot be escaped, because you're always trying to be the best that you can be and operate optimally in the environment that you're living. So in terms of successful aging, we're going to look at what it might be considered. What is successful aging? Some of the ideas around how you can be your best. Let's talk about what aging is not. It's not a disease. Have you ever said to yourself, "Oh, my aching back"? My observation is teenagers say, "My back is aching." Somehow, we own it like it's ours, when it's just your back. And this might mean that you have a misconception about the fact that aging is not a disease. And it doesn't cause symptoms. Other things cause symptoms, but aging itself does not cause symptoms. What do we know about aging? So it occurs at different rates. Has anybody gone to their class reunion lately? Okay, well, I don't know that I have to say anymore, right? You can be the same age and look more beautiful and engaged in life than you did at 17. And you could have been the high school football star and not have aged very well. It does increase your susceptibility to conditions, but there are things that you can do, as we'll talk about later, to decrease the likelihood of that. And it is associated with loss. The first part of your life is often associated with gaining things: education, children, homes, possessions. And the later part of your life is often associated with loss of parents, of abilities. Characteristics of aging. It occurs at different rates, both among individuals and within individuals. So you might have jet black hair that's all your own, and a not healthy heart. You might have gray hair and have the most healthy bodily functions. You know, they're not related. So it changes within and between individuals. Cellular and physiologic deterioration is often the case. Increased mortality with age, increased vulnerability to disease, and decreased ability to adapt to stress. So that all sounds a little bit negative, and some of the common views are that changes that come with aging are all negative. And they certainly are not. Do you feel that you're more wise than you were when you were 10? Okay. I think you'll be more wise in 10 years than you are today. Have you increased your knowledge? Have you taken a class? Here you are. Have you increased your spirituality? Has that deepened and grown? Have you had more experiences that were memorable and life-enriching? Aging-related processes are not amenable to intervention. All of our services are interventions, so that certainly is not true. Aging-related changes are irreversible. Not always true. So I am presenting an alternate perspective today that I would challenge you to accept. More adults experience successful aging today than ever before. And that's because even though people actually live more years, they also live more active years. So they can do more longer. That is a fact. Believe it. People's lives have increased in numbers of years, but people also have more life in those years. They can do more things. So here is our idea of what successful aging really is. It's characterized by a low risk of disease and disease-related disability, high mental and physical function, and active social and productive engagement with life. And these things all relate to all the parts of the communities that we are going to talk about later. These ideas can be expressed and are key to whatever the definition of community that you happen to be experiencing at any particular age. Just generally, breaking these down, low risk of disease, being active, following a healthy diet, managing stress and anger, that's a hard one, controlling diabetes and controlling blood pressure, high mental and physical functioning. Think to yourself, am I engaged 2 or 3 times a week in something that I enjoy doing? Have I taken up a new physical activity? Have I continued and modified something that I've loved doing my whole life? Have I engaged in continuing education in my own profession? Or in something new? Have I taken up piano playing that I'd never done but always dreamed of and now I have the time? Or taken an art class? Key element in successful aging. And an active social life. Very important. Things that you think are social aren't necessarily, like going to the movies isn't necessarily social. So are you engaged in things where you have to interact with people, like bridge, or an event where you're not just all observing the same thing? People think bingo's social. It's really not. I know you love it, maybe, perhaps, I don't know. But it's really not very social. Important to know. To be old does not necessarily mean to be sick. Again, active life expectancy has increased, so you can expect to enjoy the same activities you do, or you have a greater likelihood of being able to, than you might have 100 years ago or 50 years ago. Overall disability rates in older adults has declined. That's a wonderful piece of data. Greater knowledge about lifestyle factors and how they impact the aging process. And so, people care that you have functionality later for more years, and the research has revealed processes and techniques that allow for a healthier lifestyle. Greater knowledge about psychological factors that may affect aging is also available. Why? Maybe because you're a large part of the demographic, maybe because it's a natural evolution and a body of knowledge, but nonetheless, these things are all wonderful for all of us who are aging. There's no one who's not. We're all aging at the same, we're all taking about an hour to age together, right? So some demographics. Currently, about 14% of the population is over 65. And it represents, that group, our group, represents about 50% of physician visits, about 30% of prescribed medications, about 90% of long-term care beds, and about 50% of hospital stays. Here's some suggestions, and they're somewhat related to community, and there's some things that I think even a very highly educated group like yourself would just benefit from a reminder. My experience running senior living communities for many years is even the most experienced and educated individuals sometimes get caught, whether they think it can never happen to them or whatever the reason, with not having some very important tools in place. So I would just encourage you to consider these suggestions. A durable power of attorney. It's very difficult at a moment of crisis if you don't have someone assigned to help you and to be able to make a decision for you. And I've even had attorneys that were in this situation and didn't have someone assigned. So it's really important. You don't even have to give it to them. You can have it made up, put in a file, locked up, tell the person where it is in case you need it, and it just smooths the path. And so in many cases, the sooner a decision can be made and you can be treated, the more likely that you'll be able to recover and return to your active, healthy life. So it's very important. Having a will, telling people, where it is and what you want in the future. Communicating your wishes to your family in all areas of your life. What you would want under a variety of circumstances is very helpful, because if you have someone who is looking out for your interests, or 2 or 3 people, if they have to guess and they have varying views on what you would want because you haven't expressed it, it creates a lot of family conflict, which no one would want as a result of what was going on with yourself. And even if one child doesn't agree, if they know what you want, it's easier to move forward. And I've found myself in a number of difficult situations where, again, highly educated, experienced people in the field don't take care of these things, and it ends up hurting the family, and it doesn't allow you the opportunity to continue to age successfully in some cases. So it's important to let your family know. The other thing that I've run across in many, many cases is people are trying to educate themselves about what community means to them in a particular situation in a time of crisis. That is a very hard time to be thinking clearly about what you want. It's a very hard time to be assessing the strengths and challenges of any given community environment. So do your research. Think ahead, whether it's moving from a house to a condo, whether it's planning to stay in your own home. There's all kinds of resources for that. Whether it's you want to make a plan for a disability that might need rehabilitation. If you do your research ahead of time, it's easier on the family, it's easier on you, and your chances of having exactly what you would benefit most from increase. Stay connected with your healthcare professionals and your physicians. Communicate your needs and wants to them. Stay in touch so that you can work together as a team to increase the likelihood of successful aging and for you to be in the community that best allows you to be the best person you can be at any given moment with any given set of circumstances. Okay. we are a growing group, and I include myself in that. In 2010, there were 35 million people over 65, and by 2050, there'll be 90 million. So I know that we're aware that it's growing, but those numbers are quite shocking. So when you go back home and you think, well, you know, I asked some questions and I have some ideas now, and I'm going to follow up on some of those suggestions, and I get it, but like any educational experience, that, you know, you get home and you get busy with day-to-day life. So there's some resources that, if anything else, these are important people to stay in touch with. If you find yourself suddenly in a circumstance, most organizations, hospitals have licensed social workers that are trained in answering specific questions about your specific situation. And so if you find yourself in a hospital or rehab center, just ask for the licensed clinical social worker. All the other healthcare professionals that you are staying engaged with, which I'm sure you will, they can be of help. You also want to be in touch with your financial advisors, and these are all people that you should stay in touch with in terms of your wishes. Attorneys for your durable power of attorney, and then geriatric care managers. That they're similar to social workers, but they're licensed differently, and in most cases they're paid privately, but they can be of great help. They're more popular in places like Florida. There's a couple in Erie, and you can, you know, if at a time where you're challenged with making a decision, they can be a wealth of knowledge, and they do it an hourly fee type thing. So geriatric care managers, you can usually find them, Google them, and find the ones in your area. So folks, aging folks with chronic illnesses. In 2010, there were 120 million, and by 2040, there'll be 158 million. And so what we want to talk about a little bit is, with that piece of information, and also with this information, is the sooner you engage with a service, the best chance you have to implement the suggestions and return to your form, or to minimize the effects of any chronic disease. So mean age of onset for arthritis is 55, for diabetes is 51, breast cancer 61, colon cancer 71, lung cancer 71, and so on. So those are not old ages, but the idea is to get the intervention early and stay connected with your healthcare professionals. So we're going to revisit these ideas of successful aging. The low risk of disability, high mental and physical function, and the active social and engagement in life. Those are three concepts that you can engage in all along the continuum. And we're going to use this community term in terms of in your broader community. In Erie, we've created a continuum of care that we think addresses most needs, and that the idea is, with those early onset of any condition, that if we can get you into the right intervention, we can minimize the effects and let you live to the maximum of your potential. So wellness centers, working out in a health facility, a Y. We have our own wellness center, but in your community, that is part of the continuum of care, whether it's one organization or many, that you would be sort of the beginning of the continuum of where somebody might receive attention or be paying attention to their physical, mental, and spiritual well-being. Senior centers, so maybe your goal is to be in your own home. And I think we have an expert in aging in place in the audience today. And so if your goal is to stay in your own home, senior centers are an option because you can go during the day. And what are those three things that we talked about for successful aging? One of them was definitely education and social engagement. And a senior center is sort of a place where you would engage in that type of activity. Independent living. We have a variety of independent living choices that I'll talk about in more detail. But if your goal isn't to stay in your own house, but you want to stay physically healthy and enjoy new educational opportunities and social activities, certainly living in an independent living complex is one way to achieve that with greater ease than living in your own home. If you choose to stay in your own home health would be a part of the recipe. And in home health, some long-term care insurance policies cover it, some don't, but it is one way. And you can also combine these ideas of community. So if you choose to live in an independent living community, you can contract with a home health agency to allow you to age in place in a retirement community. And in some cases, that's covered. The next level is personal care. So in independent living, you might have the opportunity to get meals. You might have the opportunity to have housekeeping, maybe some transportation. Personal care, sometimes even in the same building, you will be able to engage services like help with medication administration and monitoring of your wellness. Just a little bit additional service, but sometimes that allows you to stay in one community with one set of professionals. And it's a level of care that's very pleasant and helps you to stay out of a higher level of care. All along this continuum, that's the idea. If I get anything across, that would be it, is that, if we can intervene or be successful in these levels of care, then it reduces the likelihood that you would have to progress to another level. So in Pennsylvania, there's a level of care called assisted living, which is just a little bit more nursing care than personal care, but it's not a skilled nursing facility. And then skilled care. So let me give you just sort of an example of how I think of it. When you were born and you came home from the hospital, your mom and dad placed you in perhaps a basket or a bassinet, something very small, and maybe they kept you right in their room with them because you were tiny. And then one day they noticed as you were stretching that you were hitting the sides, and they assessed the situation, and they went, in order for my child to grow and develop, they need more. They need something different. What is it they need? Maybe a crib. So they move you to a crib, and you continue to grow and advance to be older, right? So you're in grade school, and you're in reading class, and the teacher notices that you finish the book 15 minutes before anyone else, and when she asks you questions, you can answer all of them. She assesses the situation with a tool that's appropriate for that and says, in order for you to grow and develop, you need to be in the advanced reading class. And so they move you to the advanced reading class. You flourish. You continue to be the best person you can be. You grow towards more. You become an adult. Then you just finish college and you move back home. Y'all have some of that, don't you? And you're sitting in your room, and without mom and dad saying, hey, you think, I kind of like my own apartment because I'd like to, date. I'd like to, learn how to cook, my own kitchen. So you assess yourself and you go, this doesn't really work. This doesn't really fit my life. This isn't the right community setting for me. I'm going to go get my own apartment. So I think it's the same thing. It's just a different part of your life, and culturally, we're not as positive about it. But it's the same kind of a thing. You're in your own home, and you go, you're 75 years old, and you go, hey, look at this house. I got 4 bedrooms, you know. I got a 2-car garage, but kids are gone. I'm here by myself. I never get to talk to anybody, and I don't drive anymore. So is this fitting what I need? Does this give me the best opportunity to grow? Maybe. Maybe there's things you can bring in. I'm not making a judgment about that. But it's the same kind of assessment and decision-making process with the goal of successful aging, so that we can be the best we can be at any point in our life for longer in our life. Okay, so an assessment. Every level of care that I've mentioned has its own set of assessment tools. Whether it's a physician evaluating you, a physical therapist, an independent living community, there's a couple tools that are used for personal care. One is CAT's Index for Independence in Activities of Daily Living, and this sort of rates your ability to do things like bathe and dress, and they give you a score, and if you're at this end, you belong in this level, and if you're another higher score, you belong in another level. But the broader idea is, just like your mom went, too big a baby for that bassinet, you're taking a look at where you're at functionally and what's best for you. It's not best for you to be in the wrong community. And this is one type of assessment tool that helps to determine that. This is another one. This one's for instrumental activities of daily living, and those would be things like cooking and housekeeping. Okay, same idea. They're taking a look at your functional ability and having an idea of where you're most properly placed on the continuum of care. So we at LECOM have that continuum of care. I'm just challenging you, as I talk about these generally, to think about what might be available in your community, or what you might initiate being available in your community towards the idea of greater successful aging and, life satisfaction and community, being in the right community for yourself. One of the things that Dr. Lynn has developed at LECOM is a wound clinic. And here, the idea, they do great work. I don't think there's anything like it around. It's for advanced wound care. He can answer the questions about the details. But I can tell you that, if you have a wound and you do nothing about it, the chances of you living in a different environment because of increased disability increases. If you address it, and it's healed, your chances of staying in the environment that you're in now or being in an even more independent environment increase. So that's one of our areas of the continuum that I didn't mention before. I can't stress the importance of rehabilitation in this concept, because in our inpatient rehabilitation unit, the idea is, you have a short stay, you have active therapy, speech, recreation, you have physical therapy, occupational therapy, and you return to your own home. The goal is, whether your community is an independent living center, an independent apartment, your own home, you can return. The goal is to return you to your most independent level of care. So the inpatient rehabilitation unit, there's countless stories of this success. And from running independent communities for 25 years, I know that so often our residents have an incident. They break something, and they go to the IRU, and they come back to their independent apartment. Similarly, with the TCU, Transitional Care Unit. This unit's licensed as a skilled nursing facility, but it also is focused on rehabilitation with the idea that we want to maximize your function and return you to your home. Dr. Lin and his team also developed an ACE unit, an acute care unit for the elderly. And in this unit of the hospital, the patients there are served by specially trained geriatric physicians, which makes a huge difference. You know, you wouldn't go to a podiatrist if you had, you know, a cold. So the importance of the special education that geriatric physicians receive in this special unit can make a huge difference in returning people to the maximum level of function and let them get the most out of life and be the best they can be for as long as possible. Also along the continuum of care is our new senior living center, and this is a skilled nursing facility for 138 folks, a nursing home. But going back to those concepts of successful aging, we focus on keeping people engaged. Our programs for education, our programs for recreation, for social engagement, and for wellness. We have physicians visiting. It's a teaching center. Pharmacists visit. We have a pharmacy school. Dentists, we have a dental school associated with our continuum. So whether you have that in your community or not, those are the kind of things that, you know, you have a problem with your tooth. My experience prior to the senior living center is it's very hard to have a dentist see you if you can't get to them. Very hard. There are a few that, you know, hopefully you have one in your community will visit. That's very important. I've been in the hospital over a tooth, so I know other people have. It can be dangerous. So if you can have the dentist available quickly, you avoid some of those things. So we have all kinds of services that keep people from having to go further or from debilitating further, and to be able to continue to grow in all the ways that we never stop growing if we choose to, you know, culturally, spiritually, you know, socially. That's the goal. And in that senior living center, we return people to their homes regularly. We return people to their senior living communities regularly. A small percentage stay, but many rehabilitate and return to their setting to enjoy life. So we also have independent living communities. We have and personal care communities. Parkside at Northeast is the closest neighbor to Chautauqua. If you visit regularly, you're welcome to see what I mean. Independent living and personal care, so that you get meals and housekeeping and that kind of thing, tied back to those ideas of successful aging. Parkside at Westminster and Mill Creek, same thing. Independent living only, but same idea. And then the Regency at South Shore providing assistance with medication management through our personal care program. And again, these independent communities, same thing. Oftentimes, if someone comes and stays with us for a year, they, through getting better food and social interaction and things, they may go from personal care back to independent living. So the overall concept that I'm trying to communicate today about community is that it is a flexible concept. Community is a place where you grow and you nurture yourself and others. And in order to do that, you need a certain degree of wellness. You have to be aging successfully. And hopefully I've communicated some of the suggestions and resources that will be beneficial to you in achieving that. Do you have any questions?
So we have a few minutes, and I just wanted to add that when Dr. Titzel illustrated some of the continuum of care and the idea of successful aging. If many of you in this room, if you think about if you have the experience of going into a healthcare system or got sick and that needed health care, Dr. Hansen earlier, if some of you went through her lecture, you probably will find out how complicated our health system is. And part of this is a 30,000 feet overview of what it takes, what it requires to really make an individual optimize their function and also aging successfully. So as one of these entities that she's talking about, is we have a team of people highly trained to do all these things. But the more practical things that I sort of want you to get out of this talk is that, as you think about your own health and how you communicate to your healthcare professionals and stuff, you really have to communicate to them what your overall goal is from the first set. So if you're visiting a new primary care doctor, if you're talking to a therapist, they really need to understand where you're coming from so that hopefully you get a general idea of what these level of services are all about, and you can inquire about where those services are available in your community. Because oftentimes, in my experience, is that if you have your elderly parents or you yourself are a little bit older and your kids are out of state and you are by yourself in a healthcare facility in the most vulnerable state that you're sick, you really have to understand what is available out there for you in your community. And when the case manager comes in and tells you that, oh, Mrs. Smith, you need to go to a subacute rehab, or you need to go to a nursing home. Well, nursing home versus subacute rehab is two different things. So somebody has to take the time, or you yourself have to take the time to ask the question, what do you mean by going to nursing home? Do you mean I need to move away from my house and move into a nursing home forever? Or do you mean I'm going to be there for a short period of time and work with a team of doctors, therapists, and to get my function back? And what are my functional needs that you're telling me that I need to go to subacute rehab? What are they going to do for me? Then, once that decision is made, based upon all those instruments that Dr. Titzel was talking about, you have to think about, well, okay, there's 50 nursing homes in my community, which one do I pick? And it's a very complicated process because, you can go on Medicare website, they will tell you that this is a 5-star, 4-star, 3-star nursing home or skilled nursing facility to do rehab. But what does that mean? Well, what does it mean to have a 5-star, 4-star, 3-star? And I can tell you definitively in my experience, it doesn't mean anything. You can be a 1-star or you could be a 5-star. At the end of the day, what really matters is you need to be able to go and see what that community is all about and work with the people, and you talk to the people that are in there. But see, it takes a lot of time to do that, right? So what Dr. Titzel is trying to illustrate in her PowerPoint presentation is that, now is the time when you're healthy, you know what you want, you're able and capable of being independent going out. It's never too late to plan. We plan for our retirement, right? It's not an accident that you're able to retire and you still have money to come here and enjoy yourselves, right? Well, same thing with your healthcare. If you want to age successfully, you don't know when you're going to get sick. You don't know when you're going to be debilitated. You don't want to wait until the last minute when you can't physically get there to evaluate these facilities, or you can't make the decision, somebody else is making the decision for you. That's not successful aging, and that's not good building the community, right? Because that's not the community you want to be in, because you had no part and no choice in it. So the idea is that whether it's your healthcare proxy, power of attorney, or whether it's, in the event, we all know inevitably, unfortunately, all of us die, right? All of us get sick and we die. So inevitably, some of the hard questions that you got to ask yourself is, if I do get sick, what am I going to do? If I go to the hospital, you got to figure out who's your doctor. B, you got to figure out if you get acutely sick, which hospital do you want to go to, and which hospital, in turn, are they affiliated with? So in the event that you need rehab, you need long-term care, you need home health, who do they work with, right? And then at the end of the day, if you were to be debilitated to the point where you no longer can cook for yourself or drive for yourself, what does that look like for you? Where do you want to be? And we all have to come to a realization one day that 50-year-old house that we've been in, that we built 50 years ago, we don't want to give it up. But at the end of the day, you have to be sort of honest with yourself and say, okay, I'm attached to that 50-year-old house. However, if I can't go out and cut the grass, I can't paint the walls, I can't clean the house, does that really make any sense? Whereas if I move into a smaller apartment where somebody else cooks for me, somebody comes and cleans for me, and now I'm able to concentrate and enjoy the things that I can still do, such as reading, crocheting, going out playing cards or whatever, not worrying about cutting grass or painting the wall. Well, that makes sense. And you got to start thinking about these things while you're healthy, because by the time that you're not healthy and things are failing, in my experiences, people start getting to denials, so then they're not rational in their thinking. They just hang on to the things that are irrational. And at the end of the day, you are sort of taxing your other family members, such as your caregivers, your kids, and so forth. And so it's just, some of you may feel the presentation may be a little simplistic, but it's really bringing you down to a level of this is a rampant problem. You don't have to be a geriatrician to be able to think about these things, and we want you to start thinking about this right now, because that's how you can age successfully and get to where you want to be. Yes, ma'am.
Let's say you are in your mid-70s and very healthy, and you want to move into a continuous care facility.
Yes.
Are there studies that show when is the best time to do so? And what would you advise based on your experiences?
So that is an excellent question. So at the end of the day, that there is no studies to say that the optimal age to move into a higher level of care or change in the setting will do well. That's a personal decision. So what I would say to you is that if you are unable to do things currently in your state that you know that you used to do, and now it's on your mind when you're going to sleep, you have to think about it, you don't know what to do, and you're stressing out about it, maybe that's the time to start thinking about it, okay? 2 is, of course, at the end of the day, it's always about finances, right? So how much do you have? Because these level of cares that we're talking about, at the end of the day, cost a lot of money. So to give you an example, this is just in Pennsylvania. If you go to an independent living apartment where you get your own apartment and the community provides you with food, let's say, but everything else you're independent, you're talking somewhere between $1,500 to $1,800 a month. But if you move up to the level of care that you require somebody to maybe come in and give you the medication to check on you 2 or 3 times a day to make sure that you're doing okay, that may go all the way up to $3,000, $5,000, depending on which facility you pick. Now, if you require skilled nursing facility, long-term care nursing home, where unfortunately one has a stroke and can't move their body, they can't clean themselves, and they require 24-hour nursing home, you're talking somewhere between $300 to $450 per day. So depending on your finances, right? So these continuous care retirement communities, depending on which companies you talk to, usually they have an algorithm where they look at your finances, they look at your overall health conditions, and they recommend, you should start out at this point. If you're completely healthy, you should take all your funds, sell your house, and buy this house in our community, and as you progress and stuff, they will spend down your assets and then move you through along the continuum. Because if you end up going to personal care home, assisted living, then that's when they deduct, $5,000 a month off your pot, so to speak. So there's a variety of different ways nowadays, because it is such an important topic, and these for-profit, non-profit organizations come up with great ideas and great things, but at the end of the day, you have to be able to evaluate your own personal financial situation. Now, at the end of the day, 80% of population living in a long-term care skilled nursing facility, they end up spending down in their entire assets, and then the state picks up the tab, and then that's what we call Medicaid rate in the state of Pennsylvania. So to give you an example, then if you were to spend down all of your asset after you sell your house and you still require skilled nursing facility, while the state of Pennsylvania will come and say, well, you need to apply for medical assistance, and if you're approved, then you require the skilled nursing help, then the state will pick up the tab to sort of pay for the skilled nursing facility. So you can see how expensive it is for a state government. Almost most of the state that I know, they have a moratorium on skilled nursing facility beds because they don't want any more. So the government and all of us, and I'm sure earlier if you went to the lectures earlier, the whole idea of the Affordable Care Act and all the healthcare changing, quality and all that, at the end of the day, what they're trying to avoid is for you to go into a nursing home because it's the most expensive care in the spectrum of the continuum of care. So if we do all those things earlier, better, like preventative health to begin with. You never get sick, go to the hospital. Well, that's great because you're never going to utilize all these expensive services, and that's the idea. And at the end of the day, who wants to spend time in a nursing home, right? So you have to age successfully by doing the preventative things. I hope that answers your question. Any other questions? And you can ask me about anything at this point, you know, hospital, doctors, or whatever that's related that you have questions about.
This is more of a comment. I really think that your point that you really need to make some of these decisions when there's not critical things going on. One tool that my husband and I found very helpful was a tool called 5 Wishes. It's available online, and it really walks you through things that you didn't know what you needed to ask. It's either free or like $5 or something, but we found that very helpful, just information.
Oh, thank you. We were going to check that out. 5 Wishes.
My question is about independent living. First of all, where are there some independent living places? I mean, just Googling that, is that going to give you that? One other question is, are there any situations like that that are a co-op type of thing where seniors band together and provide a co-op type of service for those who are part of that?
So I guess to answer your question, the first question would be, you know, which geographical location are you located? Which state, which city are you in? And if you have that, Googling, if you have access to Googling, the search term would be senior housing and independent living. And if you Google that, there should be a variety of things that come up within your community, because if you search Google and you turn on the location, usually you'll pick up the area that you're in, and they will give you the list of things, okay? And then your second part of your question, are there any co-ops or any sort of other alternative living? Yes, and I would tell you that it's very regional, it's very local, depending on where you're from. So for example, in the community of Erie, we even have alternative models of nursing home care. So they have agencies where they actually rent independent, regular house, you know, single family homes, and they renovate the home into 3 bedrooms, and then they leverage or utilizes the 3 individuals' benefits. So if they're medical assistants, they don't quite qualify for nursing home, but they qualify for 8 hours of help that GCAC provides. While this agency, they're very creative, they ended up using the 3 people's resources to get 1 aide to go into the house to take care of these 3 people, but yet they get 24-hour coverage, right? And then this way, the rent per room is somewhere between $600 or $700 per room, so that the whole house is a house. And you know, some people enjoy that much better than a nursing home, because you have 2 housemates essentially with caregivers, and they become a unit and family. And the idea of a family or living community or a neighborhood is very important, because when you get to that level where you can't travel outside to the community, you need to have a way to bring the community into you, right? So the services that you can't get to, somebody has to bring it in. So if you look at long-term care, nursing homes, and you want to do more reading, read about the cultural change for nursing homes. So you're going to come up and read about the greenhouse model, the different type of cultural change model. And the whole idea of that is, instead of taking a long hallway into hospitalization type of rooms, they actually break up the nursing home into neighborhoods. So there's only about 8 or 18 people in the neighborhood, but within the neighborhood there's kitchen, dining room, and activities where it's almost like your home. But it's not home, but you do the best you can. And then within that bigger community, so to speak, they have restaurants downstairs, and they have spas, and they have, wellness gyms and stuff. And instead of going out to the community, now we're bringing the community into the facility for those individuals that can't get out. And in fact, that's exactly the concept of the senior living center that we have built. So if any of you are in town or even nearby, you're more than welcome to contact myself and Melanie. And it's not so, even if you don't have a loved one that is close to being in a nursing home, I encourage you to even just go visit, just to get an idea. So the time comes when you need to, you know what the right questions to ask and how to assess a facility, whether a facility is good for you or not. Okay? Because not all facilities are the same, obviously. Yes, sir.
Can you hear me now? Do I do something with the button here? Hello? In a number of communities, there's a growing organization, or organizations known as villages. Mm-hmm. We're forming one in Charlottesville, Virginia at the present time, that's patterned after other such villages. The original first village that was established in Beacon Hill in Boston.
Sure.
And here, with these villages, members of that community, of that village, tend to take care of others, or I'll be on the watch for others in the community. All are staying in their original homes, but the community members see that those members who do need help can go to where they can go to get their help. And those communities also seek to find cheaper advice and usages, and also plans to transport them to various social events. Sure. And see that members of the community can come and do minor chores for them where needed, and this sort of thing. Do you know about these villages? Do you care to comment on them?
Yeah, I think that those villages are an excellent idea. And again, the concept of that is, what is the concept of that? The concept of that is leveraging on human nature, right? Our kindness and our compassion towards each other. And the fact that, when you see your neighbor in trouble, you're willing to reach out and help. And those are all great things. And to add to that, we have to look at our health system a little bit differently now. Because if you build a community like that or a village like that, what's the missing piece that's there that if you were to have in there would be excellent and will provide a higher level or elevate the level of care? Well, if you were to have some basic health care within the village, where your village, all the people living in the village wouldn't have to travel too far to see a doctor if they have a cold and sniffle. If you have a home-based nursing agency that's within the village, where if somebody were to have any trouble, you can't reach physicians because they're expensive. So you have nursing staff there that could be the eyes and ears for the physicians to assess the people in the village. Then you can begin to see that any early signs of illness or sickness that causes to be in an acute hospital can be prevented, and therefore you can avoid all the detrimental effects of an acute hospital stay and all the other things to get you back to your level. So the idea is still, picking up the disease and recognizing things earlier, and then to add to that, you can also build on a medical fitness wellness center into the village, so that the members of that village could actually exercise, do group program, do morning tai chi to have fall preventions, cook together to make it healthier and things like that. And these are all community activities that will promote wellness and healthy. So in the context of building a successful community and living, that's exactly what we're talking about as you age, because you have to leverage each other, whether it's your family, friends, or your neighbors, and that's exactly what it is. And plus, socialization is very important. We know that as you get older, if you're socially isolated and you stay at your own house, you can't get out, 50% of those individuals get depressed, and when you have depression that's undiagnosed, your likelihood of dying or having other medical conditions goes up tremendously. So all of these, remember, it's mind, body, and spirit. So as long as your village is addressing all those three things, it can be a very successful community.
I know we're all concerned about money when we get into this situation of having to go to an assisted living place or nursing home. And there's a greatly unused Veterans Administration or VA benefit for any member of the armed services or his spouse or her spouse who have served during wartime. You don't have to have been in an actual battle with a gun, but as long as if you were a cook here in the United States in the training camp during a war or something of that nature, you still can be eligible for this benefit, whereby under most circumstances, if there's a monetary need, the VA will contribute somewhere in the neighborhood, I believe it is $1,600 or so for the husband. I'll use the husband as the person who was in the military. And even if the husband's wife is in need, there's another approximately $1,200 available per month for her. So it's a very good idea to keep in mind there are other resources such as the VA.
So I'm glad, thank you very much for that comment. I'm glad you brought that up, and that's an example of how complex our system is. So when Dr. Titzel was talking about a geriatric care manager or social worker, these are the questions you ask them, right? If you need. That's the questions, and if they don't know the answers, that's their job to help you navigate those resources and maximize the resources that you're going to have. And there's all these hidden things, long-term care policy, insurance, different policies have different things. So, if you're going to get into a long-term care policy, somebody's convincing you to buy one, you have to ask the question, well, how long does it cover? What skill level of care do they cover? And how much it is, right? So these are all important considerations to keep in mind. Thank you.
Even if the spouse has passed away? Thank you.
Do we have any other questions? Well, thank you very much. Give Dr. Lin and Dr. Titzel a warm round of applause.